Hello, and thank you for joining me today. My name is Edward Madou. I will be presenting my original proposed research entitled Imagine and Real Walking Effects in People with Lower Limb Amputations, an fMRI study. Successful walking and independent mobility are the most important factors regarding quality of life in individuals with lower limb amputation. Intensive prosthetic rehabilitation is essential following lower limb amputation to help recover these abilities. However, postoperative healing, pain, and limited strength and endurance may hinder effective rehab. Difficulty walking even after completion of rehab programs is common and can result in falls and reduced quality of life. Therefore, due to the importance of mobility and walking, we need to find ways to enhance rehab and improve the outcomes of these individuals. Motor imagery involves picturing and feeling oneself completing motor tasks without physically executing the movement. Motor imagery of imagined walking has been shown to activate the same areas of the brain as actual walking. And the implications of this are that neural connections may be made that may help in facilitating future active movement, therefore helping to overcome those physical barriers that may hinder effective rehab. Motor imagery training in individuals with Parkinson's disease and stroke has been shown to improve functional scores and gait compared to physical training alone. However, functional reorganization of the motor systems in the brain following amputation may affect activation patterns of the lower limb. Additionally, the most common cause for lower limb amputation is dysvascular in nature, that being complications due to diabetes and peripheral vascular disease. This type of amputation may have additional neurovascular changes that could impact activation. Therefore, success of a motor imagery intervention in this population is dependent upon the ability to demonstrate adequate brain activation patterns. This can be done using functional magnetic resonance imaging, or fMRI, which can directly examine brain activation patterns during real and imagined activity. The objective of this study, therefore, is through the use of fMRI to evaluate the relationship between motor cortex activation during imagined walking and gait parameters in healthy adults and those with a traumatic and dysvascular lower limb amputation. We will be collecting 3 groups of adults aged 18 or over, and the groups will consist of 20 community-dwelling healthy adults and those with unilateral transtibial amputations from the outpatient amputee rehab program at Parkwood Institute. These will then be divided into 20 individuals with a traumatic lower limb amputation and 20 with a dysvascular lower limb amputation. As seen here in Figure 1, this study will be conducted over 2 visits, the first of which will include a battery of questionnaires as well as a gait assessment of a participant's usual walking over 3 trials along a 6-meter gait right walkway. Visit 2 will then consist of the fMRI assessment, and this will be done in a blocked method consisting of active and imagined knee flexion extension and imagined walking. There will be a total of 5 blocks performed for each study participant. Following each imagined block, participants will rate their ability to see and feel themselves completing the movement using the visual and kinesthetic imagery scales in the revised movement imagery questionnaire. Spatial temporal gait parameters, velocity, cadence, and stride variability will be collected, and these variables represent the gait domains of pace, rhythm, and variability respectively. We will also use fMRI image acquisition to collect the volume and intensity of cortical activation during imagined movement. Figure 2 shows some preliminary fMRI images obtained during active and imagined movement. A one-way analysis of variance based on group factor will be conducted to examine differences in volume and intensity of cortical activation, with Tukey post-hoc testing should any significance be achieved. Additionally, Spearman correlation analysis between gait parameters and cortical activation will be conducted. In summary, the observations from this novel study may help expand our current knowledge of the brain-motor relationship in those with lower limb amputation, and may provide support for the development and testing of motor imagery interventions with the overarching goal of advancing prosthetic rehabilitation and improving mobility outcomes and quality of life. Thank you for listening.